Hey, hi Sumeet. Good afternoon. Uh, I hope this is recording. It says recording, so I'm assuming it's recording. Uh, so good to catch up with you this afternoon. So I wanted to actually talk to you about a webinar or online webinar that I went to 2 days ago.
Mm-hmm.
And the topic was AI in healthcare. You would have seen it on my LinkedIn post as well. It says AI in healthcare. It was set up by a media house. The beauty about it was there were at least 8 to 9 panelists very knowledgeable about AI in healthcare and how AI can help healthcare, right? And there I was trying to think of things to say, right? Of what is required, what can be done, etc. But what I want to ask you is, I have not seen any AI in any of my healthcare interactions in the last 5 to 6 years. Right? So when I've been to a hospital or I've been to a patient, a clinic to consult a physician, I have not seen any in healthcare. So have you seen any AI in healthcare?
Great question, Dr. Vikram, that you have asked. And let me begin by saying that, especially about this unprecedented crisis through which we all are going through, it has accelerated the digital transformation journey of the enterprises across the globe. And I firmly believe that technologies like AI will play an imperative role in transforming the existing businesses and creating new revenue streams. Now, if you're talking specifically about healthcare, I do concur that in India specifically, there have been talks about AI mostly on papers, okay, or in business meetings or on webinars such as you attended. But nothing concrete has been done so far. There have been few cases here and there, but nothing strategically concrete that we can point out to. But I see that a lot of work in healthcare related to AI has been done outside India, be it in other Asia Pacific countries or in European countries or in North America as well. So I believe that in a country like India, we are laggards of adopting technology, but we see a lot of use cases, as I say, especially in COVID. Also, AI has given a lot of boost and fillip to global efforts in identifying communities at risk, arresting the spread of this contagion, as well as helping in discovery of vaccines and relevant drugs. So I do feel that this is the right time where countries and emerging economies like India can adopt AI.
You're right. Probably one of the speakers, he gave a long list of AI startups and companies and what they were doing. Like he went on for about 2 minutes. There was no, and it's very difficult to even remember that list or write it down because he just went on. Oh, so and so company, so and so company, so and so. He did talk about our friends from IBM as well and the Watson. But he gave like 20 odd names and said they are all working in AI. The closest I've seen to AI now that I remember is my own physician. The last time I went to him, to his clinic, I usually go to a hospital where he consults, and this time I went to his own clinic, and he has this like something like a scanner that's on the desk, and you put your prescription through the scanner, and I got the prescription on WhatsApp. And I think the system is called Deep Health or something like that. I'll dish up the name. And then that system keeps sending me reminders that I need to go consult him every 15 days. So whatever it is, I mean, that's the best I've seen so far, right? I've not seen too many. I haven't had too many inpatient experiences. But the question I want to put to you and put to myself as well is what stops us? I don't understand. There's so much gyan. When you go to these conferences, you get gyan on this, gyan on that. There are, dime a dozen engineering colleges in India. There are so many innovation labs, so much happening, so many hackathons, but not one decent AI system uh, that is user friendly. Being doctors, we know how difficult it is. In India, why do you think we can't build a system?
I think there are multifolds of reasons here. First, I believe it's in our culture. Now, if you talk about doctors adopting AI, many of them feel that AI is there to replace them, which is absolutely not the truth. Okay, AI is a system which will augment or support their decision-making system. Okay, And so doctor needs to be educated, I think, right from the medical colleges or the dental colleges, where doctors and ancillary staff, they receive education. They need to include AI as a subject. Okay. Second, I believe that the government needs to play a huge role here. I know that in a recent policy by government of India, there's a separate regulatory body within India, and they have kept aside, I think, $1 or $2 billion specific to AI, not only in healthcare but industry as well. It's just on paper. Okay, I hardly see any use case, any business related to that. So I think these are two or three major reasons I see, and I also see a reason is lack of talent. Okay, and not many are equipped in India to use AI, to talk about AI, implement them in healthcare. So I think there are various reasons. And coming to government, like, I like to put a question to you, Dr. Vikram, that you work with a lot of government agencies as well. They have the intent, but what happens later on? Like, why they're not able to adopt it, or cost is a factor, because most of this are run by companies or startup funded by companies. Is that true? Do you see cost a major hindrance?
So, you put the topic back on me. But I'll tell you something about governments, right? There are a couple of interesting scenarios how this plays itself out. So I just finished a report on the analysis of the election manifestos from 2014. I was reading an article in Times of India where Dr. Devi Shetty said that health will become a poll issue now. And this came out about 2 weeks ago. Very interesting article. He said people demand better healthcare and elect their representatives on basis of what are the promises for healthcare in their manifestos. So I went back to the 2014 election, because that was a very big turning point in the political history of India. And I looked at the manifestos of 5 or 6 parties, and I found that at best health was given about 2.1 to 2.3% space by national parties, but all the national parties, right? And the regional parties gave some more space, and that went up to about 5 to 6% at best for some of the regional parties. So clearly, if you can't even dedicate more than 5% of the text on your manifesto to healthcare, why would healthcare be a priority for the government? That's number one. Number two, I think AI at best will work at prevention to a great extent of diseases. I don't think politically it makes sense to invest right now, the way our thinking is right now. Post COVID, it might change. But the way the thinking was pre COVID was, how can I make people realize that I've saved them something that they have not experienced? You understand what I'm trying to say? I intervened early and prevented diabetes, but you never had diabetes. So how do I know? And how can I milk that moment? And number three is, for a long time, and this is something I wrote in my report as well. India is a very fatalistic country. We believe in fate, and you get disease, you have an accident, it's your fate. You got into diabetes, it's your fate. Somehow, we leave it to fate and not into our own actions, right? So I think these three factors, and I think most political parties are very aware. They master, the understanding of consumer behavior so well. They know that if they talk about something like this, it may not be a poll moment. And that's the reason they probably don't pay attention to it. And when it comes to AI systems, which will probably prevent a lot from happening, focus more on prevention, they don't see as a major incentive to go ahead and proceed with this. So I think that's the bottom line. But it's always great talking to you, and great session today as well. And looking forward to continuing this chat, and this debate on AI and healthcare. And I'm going to term this topic as, why don't I see AI in healthcare in India? Because I haven't seen much, apart from a few examples that major hospitals have done. All right, thank you everyone, and have a nice day.